Hello, and welcome to Feeling This Life. We're a family support podcast that dives deep into the triumphs, challenges, and strategies that are part of the lives of those who care for young children who are blind and low vision. I'm Paige Maynard, and I'm a teacher of the visually impaired and early interventionist at VIPS, Vision Interventions and Parental Support.
I'm Jenny Castanier. I'm the Family Services Coordinator at VIPS. I am the mother of 3 girls, and my youngest has a visual impairment.
And I'm Dr. Cathy Smith, an independent research and educational consultant out of Fort Collins, Colorado, as well as a former early intervention provider for families of young children with visual impairment.
Welcome to another episode of Feeling This Life. I am here today with 3 VIPS moms. I'm going to let them introduce themselves and tell you a little bit about their families.
Hi, I'm Hillary Warren. I have 3.5-year-old twin boys. They were born at 27 weeks, and one is, for lack of a better term, typically developing, and the other one has many complex needs. In a nutshell, he is deaf, he has cortical visual impairment, and he has spastic quadriplegic cerebral palsy.
Hi, I'm Kelsey. I have kids. My oldest is 8. Her name is Bree. I have Gunnar, who's 6. And I have twin girls who are 3 and a 1-year-old boy, Barrett. My twin girls are Kaylee and Brinley. Kaylee is our medically complex kid. They were born prematurely at 33 weeks. She has a brain injury, which caused a lot of secondary diagnosis, which include hard of hearing, cerebral palsy, cortical visual impairment, and the list can go on.
Hello, I'm Kate, and I have 3 kids. My oldest, Edmund, is almost 6, and then I have 3-year-old twins, a boy and a girl. Halsey, my daughter, is tracking well developmentally, and then my son, Finn, is our medically complex kiddo. He has cerebral palsy, epilepsy, cortical vision impairment, chronic lung disease. He sustained 2 separate brain injuries after birth. Twins were both full term, but they had a viral infection go to their brain, and Finn unfortunately had it happen a second time, which caused more traumatic brain injury.
Thank you so much for being here today. I've had the pleasure to get to know some of you and your kids during your time at VIPS, and my co-host Paige is or was the TVI for all 3 of your families. We have both been encouraged by your relationship and how you have built this community for yourselves. How did you meet?
We were introduced by mutual therapists. So each of our kids is very unique with their diagnoses, with brain injury kind of being the common thread. But Kelsey and I were introduced by a teacher of the deaf that we both had. Shout out to Nikki Coleman. And Kate and I were introduced by a mutual PT, Paige 40. So both of those women are wonderful, and I will forever be grateful to them for realizing a need and asking, hey, are you interested in connecting with another family? And they just shared the contact information, and we took it from there. So it was therapists realizing that we had something in common. And I think the twins factor is what really kind of made us stand out to them.
That's it. I think we all 3 had very similar situations that we had twins, and one was developing on a, typical scale or maybe just a little bit delayed, but we each had a pretty medically complex kid that we shared commonalities with. And the therapist did see that to say, hey, this is odd, but I have a kid that is a very similar situation as you. Would you like to, talk to the mom? And like Hillary said, I'm grateful for it because I don't know anyone else that has twins that are in the same scenario as us. So it was very helpful at the time, especially. I think Kaylee was maybe 5 months old when I was introduced to Hillary. So we were going through a lot of the same kind of walk through life together. And then Hillary introduced Kate and we went out for lunch, I think.
Yes.
So then we could all meet in person. And that's when I met Kate and we shared stories and got to know each other.
Yeah, and I think Hillary and Kelsey kind of covered everything. I might just add that as the twins are getting older, it's less about the twin connection that we have and more just the medically complex piece of things. Our twins, yes, they are twins, but they're also very different in that it's almost hard to imagine them as twins because Finn is his own unique person because of all that he's been through, and Halsey is her own unique person.
I can tell just by the way you all talk to each other and things that Paige has told me as well that you all are friends. Did your friendships just develop naturally?
I feel like it was pretty natural because we had that common bond. It was easy. You always had something to talk about and kind of bring up with each other. And when you went through the struggles, they related more than me talking to some of my other friends that were, friends that I had pre-twins. For me, it felt very natural to just reach out to them.
Yeah, and I think we're all kind of at the same stage of life with the twins. So we're all kind of going through this together. And so it's easy to ping pong questions, ideas amongst the three of us. Whereas, I have other friends with kids that are much older. So just going through this journey with twins that are all relatively the same age is very helpful.
Mostly our friendship is just texting. Like, our lives are so busy. But I feel like shortly after the first introduction, the texts just kept going. There was always some appointment to talk about or something to vent about. There was just always something.
I'm glad that you said that about the texting because I know that probably a lot of our listeners are thinking, wow, even if I could find a friend to support me through this, how am I going to have time to devote to that relationship and actually build that? So I love that it's still developed even through text. Do your husbands connect with each other at all?
Yeah, when we get together in person, which is not as often as any of us want it to be. But yes, our husbands know each other and our kids, the ones that are old enough to remember, know each other. So yeah, we try to get our families together when we can, but I'm not sure it's even happened a handful of times.
As they get older, do you plan to try to help them develop that relationship so they can live that shared experience?
I sure hope so, especially since the twins are all around the same age. We had a sweet moment recently. My family, we went into Home Depot for something, and a little girl pointed at Gabriel's wheelchair. And you know how it is when you see somebody out of context, you don't realize, oh, I know that person. So I got ready to talk about, oh, yes, he has a wheelchair, and, just do a little sweet thing for a toddler pointing at a wheelchair. And then I saw Kate's husband, Ned, and I was like, oh, she's not pointing because he's in a wheelchair. She's pointing because she knows us. And I just thought that was so sweet that she was like, hey, I know that kid.
What do you tell your other children about their sibling?
So in our situation, we had 2 older kids, and Brinley came home from the NICU at 22 days and looked like a typical baby. And then Kaylee came home at 63 days, and she has no gag reflex. She can't swallow. So everything she's ever eaten her entire life was through some tube, through the nose, or now she has a G tube. So that was one of the first introductions. She came home not being the neurotypical child baby that most kids are used to seeing. And then she also has a suction machine because, like I said, she can't swallow. So we have to rid of all of her secretions through her nose and her mouth. And luckily, we were in a situation that we got our home equipment before bringing Kaylee home. So we were able to show them a suction machine, and the hospital had gifted us little stuffed animals that had G tubes, and they gave us pump bags. So we got to show them and prepare them. And one of the hospital psychologists even wrote a book about Kaylee, the sound she makes, the machine she was going to use. So we got to read that with our children. They got to see pictures of her all the time. Thankfully, the NICU had cameras that you can access 24/7. So our kids saw her from day one, and we were just kind of open to the degree that they could handle at their age. So they don't know exactly what happened, but they do know her story, that she was born early. And as they age, they ask more questions, not really about what's going on with her as much as how did it happen. And so they've always seen the differences from the beginning. And that's just how Kaylee was. And we've always told them, God makes everyone different. And that's just how God made Kaylee. And so they didn't see her any differently. They didn't see her as weird or we can't go near her. They loved on her just the same, if not better than their twins sometimes. They just think everything about her is so cool. All of her equipment, every need that she has is so cool to them. We weren't in a situation where, she came home and seemed like a typical baby and then things changed as she aged. It's always kind of been that way for them.
I love that with the stuffed animals. Oh my gosh.
Yeah, that was very helpful for our kids to be able to experience that and play. And then they even use those stuffed animals alongside us when we were feeding Kaylee. It was like, oh, I've got to go hook up my bear. And they would hook up the extension in their feeding bag, like part of life. That's how they role played with baby dolls.
Alexander's in that phase right now too. Like if I'm doing something with Gabriel, he has to go get some stuffed animal and do the same thing. And one of his bears is wearing Gabriel's old AFOs. But for us, they're growing up together. So it's all that Alexander has ever known. And we're not really at the stage yet to where he's asking any questions. And so we'll figure that out. I'm sure I'll pick Kelsey's brain and Kate's brain about that when we get to that point. But for now, it's just his brother and he loves him and, he includes him in his own way and he learns a lot from the therapist. So he tries to make sure that things are CVI friendly for Gabriel. He likes to push him in his gait trainer. He likes to help lift his head up when he can't keep it up in a chair. So they actually, it's different. It's not what you would imagine when you find out you're having twins, but they do have a very sweet relationship. And for now, Alexander doesn't know any different. I do try to watch my language sometimes, like, with potty training. I try not to say like, oh, you're such a big boy now, because that's confusing. Maybe not yet, but I do think it could start to be confusing. Like, well, Gabriel's the same age as me. So what's going on here? And I'm sure those conversations will happen later. But for now, everybody's just happy with who everybody is and not questioning it.
Yeah, I think for my twins, it's all that they know. They were born together and they're aging together. So Halsey, that's just her brother and he is the way he is. I think for the older brother, it's maybe a little more of a learning opportunity because you do see your brother and your sister and one of them is walking and talking and eating food with a fork and a spoon and the other one can't sit up, can't walk, can't talk. So it's much more noticeable for an older sibling. But again, I'm grateful for the opportunity that they can grow up with that experience and they understand that not everybody can walk and not everybody can talk. So we're all taking it in differently and we're all asking questions for different reasons.
How did these relationships make you a better parent or change you for the better?
I think it's having each other. I know for me with Kaylee, we went through a really rough first year. She was in and out of the hospital. So just to have someone else that understands what hospital life is like to connect with, to not feel alone in those situations. And then we're always there for each other for advice. I can't tell you how many times, even like through Paige with VIPS, that we've been able to collaborate and come up with ideas, or we do something that we think was really good for CVI, and we can then like share it, or they share their tips with me, and that's helped me help Kaylee with her visual impairment especially.
For me, I was a first-time mom with the twins, so it's helpful for me sometimes that Kate and Kelsey, it wasn't their first time around. So sometimes in conversations with them, I'm able to take a step back and realize that, maybe I need a different perspective, and maybe that's just the first time mom coming out. And that's really nice that that's a little bit different. But also, it's important to have somebody to talk to. Towards the beginning of this, I looked into doing therapy, but it was so hard to find the time to do therapy. And then putting yourself out there with somebody who doesn't really get it, it wasn't a good fit for me. And not that Kate and Kelsey are my therapists. I'm sure I've done more than my fair share of trauma dumping, especially in the beginning. When Kelsey and I first met, we had recently found out about Gabriel's brain injury. We didn't know until he was 8 months old. So I was in the thick of processing, and it was very overwhelming. And just having somebody to talk to about some of those feelings definitely made me a better parent, because then all of that wasn't coming out while I'm trying to parent my children and live my life.
It can be very isolating when you think about all your other friends that don't have medical equipment and know the lingo and go to hundreds of doctor's appointments constantly. Hillary and Kelsey have reminded me that other people are on the same journey that my family is going through. And just knowing that there's other families out there is sometimes just enough comfort to get through a tough day. Having the connection with Hillary and Kelsey has been such a comfort to me, just knowing that they're there and they understand what we're going through.
What would you tell others who want to build a network?
You do have to be vulnerable. You have to put yourself out there, and you have to be honest. Going into, I think Hillary texted me first, but going into that, I was open and very honest and laid it all out there, what was us, so that we could build the connection very early on. Because if it isn't, if you're not true and you try to hide some of it, because it is hard, living this life to fully put yourself out there, and you have to be very vulnerable to put your children out there as well, and to show someone else all of their disability. Mm-hmm. So I think for me, you have to allow yourself to let your guard down, be vulnerable in the situation, be open, and trust that other person is, going to have the same intentions. And also, I put it out there with therapists, and when we got connected with different organizations, I'd be like, yeah, anyone please, I'm willing to talk to anyone, just so that way we could find the connections. Because if you don't tell your therapist, just per HIPAA, they're not going to share. They have to have your permission to share. So I think that was also helpful to just be like, hey, please help me find friends. Mm-hmm. Or if you see anyone that is in a common situation, I would love to be there for them, just as others have been there for me.
I would also add that 99% of the other moms and dads that are going through a similar experience or journey have kind hearts. How can you not, with these angels who provide us unconditional love every day? It truly changes your outlook on life and the friendships that you make moving forward. You're much more intentional, and you surround yourself with people that are going to love your children and your situation. So I think don't be scared. These families that we're doing this with are nothing but kind and supportive.
And also know that we were lucky here that it turned into friendship. There have been other parents that I've connected with, and maybe you have a couple conversations and then you see them every once in a while at an event. So for every 5 moms I've texted, I get one that turns into something like this, which is really cool. So don't get discouraged if you don't find a friend right away. But also for organizations like VIPS with so many wonderful events, it's a lot easier to connect with people in person. I have 2 different families that I've kept in touch with from the family retreat, and there's always some event going on, and it's a lot easier to make connections when the organizations are hosting, fun things for similar families.
And when I say therapist, we do mean our kids' therapist. I don't know if your counseling therapist would be able to share information, but we were strictly talking about our kids' therapist that did connect them.
Now that you're about 3 years into this journey, what do you wish that someone had told you at the beginning?
For me, and maybe this is the first time mom coming out again, but for me it would be to trust your instincts. I knew that something was going on well before we found out that something was going on, and I was constantly reassured by all of the doctors. And in hindsight, that's the one thing I wish I could have changed, to start early intervention sooner, because I knew something was different.
I think for me, I keep hoping it'll get easier, but I don't know that I would ever tell anyone that, because it just gets different, maybe not easier. But I think maybe don't stop advocating for your child. You are your child's biggest advocate.
Yeah, I have to agree with both Hillary and Kate. Definitely trust your instinct. If something feels off, don't be afraid to speak up. Doctors don't know your kid like you do. They're medically trained, but sometimes you just have that mom intuition that says that's not quite what's going on. And don't be afraid to speak up, advocate as much as possible in every setting, because you are your child's voice. And if you don't, no one else will. You have your child's best interest in mind, and only you can really push for what you think is right for your child. And like I said, in any setting, whether that's the school system, in a doctor's office, at the hospital, just always keep the fight going. It's hard at times because you do have to keep fighting what feels like all the time, but it's really worth it, and it's what your child needs.
I was just thinking, use the resources that are given to you. You might think, we don't need PT, or we don't need vision therapy, we don't need Medicaid, or we don't need this device at our house, but you just never know what path it'll take you down or the connections that it will give you.
When I was listening to that interview, I went from goosebumps to teary-eyed to I just wanted to give them a hug and a high five, because I love listening to their stories, from their side. And it reminded me of all of the wonderful times that we've had together in our home visits. It was just, I feel like, a highlight of my career. The way that they all worked together, I feel like, was a really fun challenge, I think, for me. So just kind of sharing how it was like. I loved how they would frequently share information from what we had done at our visit with each other. And sometimes I would even say, hey, maybe you should ask your friends about this, because, we want to keep confidentiality, but then also I wanted for them to collaborate. So that's something that I would do. For example, some of the things that we did were Kaylee's family wanted to make some books that were accessible for her CVI. And so we made them specific to what her needs were. And then I would think, oh, I bet Kelsey's probably going to talk to Hillary and Kate about this too. So I would have to think, oh, I bet they're probably going to want to do this at some point. So let me think about how would an accessible book look like for Gabriel, and how would it look for Finn, and how can I support the family in doing that? So it ended up being really cool to see how all of them kind of navigated early intervention and the things that they wanted to focus on kind of in tandem with one another. And I think it's because they were talking to one another about their priorities and the things that they had done. But then it was also a fun challenge for me to think about and to try to anticipate what that might be, so that I could support them in sharing their experiences with each other, but then also support them for what their like individual family needs and what their child's needs were. So like for one of the families, having the siblings be able to make the books along with us was really important. And so Kelsey came up with different ways to help older siblings like make their own books on their own time. But then another one of the families, it was important that we get the book done like all in one day so that it was finished and ready, you know, and the sibling felt that they were, like that they had accomplished something that day. So it was really cool, I think, just to see how all that worked out together.
It sounds like it's an amazing demonstration, Paige, of using differentiated instruction with families, right? So we really do that in early intervention, and how great that you have such a good example.
Yes, yeah. I feel like I could go on and on about it. You know, one of the books was about those Mardi Gras beads that a lot of kids with CVI like. For one child, they were one color. For another child, they were another color. The text sometimes was different depending on what the child liked, so it was super cool. Another thing that I think was really cool that they wanted to do together, which again was a really fun challenge for me and something that I hadn't experienced before, is they wanted to get their kids together for a play date. And because they're the awesome moms that they are, wanted to make sure that they had good strategies in place to help their kids to build those bonds with one another and to kind of enter with good self-regulation and learn from each other. So we did some work prior to a play date where we talked about what might be helpful for helping Kaylee or helping Gabriel or helping Finn to be able to know that their peer was there and interact with them and positioning and all of these things. And then we also did some visits that were actually play dates where one of the kids would join in on the other kiddo's session, and that was really, really cool, and I think a really cool experience for both them and me as the teacher. That was really cool, and I feel like I learned a lot from them. And another thing that Hillary talked about, I guess I would say maybe as a challenge for me now, and if I think a fun challenge, is some of the language that she said that she tries to be cognizant of around like specifically potty training for her other child. So I thought that was super interesting and something I really had never thought about with what she said about, as he's potty training, thinking about using words that kind of look at his strengths and also don't discount, anything about Gabriel. So what do you guys think?
Yeah, I really liked how she talked about that because I feel like that's something that you don't necessarily think about in the younger years. Like, you don't think of how terminology can make a difference, or are they really paying that close of attention? But I think it's great that she is already, thinking through those things and implementing that. I mean, it's something like my kids, they all have different strengths. And so regardless of if your child is medically fragile or, typically developing, they all have different strengths. So, and just because one isn't good at something the other one is, doesn't mean that it's a bad thing. So I think it's okay to celebrate what Alexander's doing, like he's potty training, but the way that she does it to not be confusing with Gabriel, I think that's great. And, we do the same thing with our kids, just kind of normal. Like if one's in an advanced class at school and the other one's not, it doesn't mean anything bad about the other one. That's just not their thing. And we can still be like, hey, good job, you worked hard. But it doesn't mean that the other one didn't work hard in their class as well. So I know that's kind of surface level, but kind of the way I was thinking about it, I think it's great that she's already like implementing those things.
I don't think it's surface level. I think it's really something that happens. Like, what's important is that you celebrate your child's strengths just like you like, regardless of what they are. And siblings are kind of an interesting take on all of this. So you do have to learn how to navigate that, and how do you support the sibling of a child with disabilities, because you are going to spend more working with them. And a great resource that we want to share in the show notes is something called Sib Shops, which are They're presentations and opportunities for kids who are siblings of kids with disabilities to interact with each other, so to talk about what it's like to be that sibling, and that anything that they say is okay and safe, and all the feelings that they might have, because they are going to have feelings. So siblings are people too. So we want to make sure that parents have, help kind of navigating that, I think.
Yeah. And we're going to put, they talked about the Tubie Friends or the stuffed animals that they used. I'm going to put that in the show notes too, because I just think that's such a great way to not only prepare kids, but to let them be involved and understand as well. And I think Kaylee's family was really blessed in how proactive their doctors were and their medical staff. And I know we don't all have that. So I think that it's great to, be able to, get that whenever it's needed. Awesome. So I'll put that in the show notes as well.
I think there's kind of a little theme here happening where that families should feel okay if they don't quite know what to do for these seemingly typical things, right? Like having a play date. What a fabulous idea to practice having a play date so that they feel more confident that it's going to go well, or using doing a tube feed, or all these other things. Or just because kids don't come with a manual doesn't mean you don't need help. Right? I think, and do we have all the answers, Paige? I don't think so. But, like Paige was saying, I've never thought about how do you address the issue of potty training with the sibling who's doing it and the sibling who's not. So we have to figure it out too. So that's why it's really important to work with families to do that.
What words do you think are better words to use when talking about one child's success with potty training when the other child might not reach that milestone? I know you're such a big boy. Hillary's right. It doesn't mean Gabriel's not a big boy if he's not doing it. So what do you think is the right thing to say?
I mean, I don't know that there's one right thing. I think that puts a lot of pressure on as the parent. But just knowing your child, what drives them, or what are they interested in? Like, that was great. You really took care of yourself, or, just flat out, I'm so proud of you. And it's not that you're not proud of the other one, but it's okay to acknowledge that child's success. I mean, that's kind of my thought on it.
Maybe, so just making it more general. Right? So not being specific about, oh, you're a big boy because you went potty, but what a good day we're having today. Gabriel did this and Alex did this and I did this. So we all had a good day today. If you can pull those things out, I think would be great.
Yeah, I love that. So I think some of the other themes that kind of emerged from this was, of course, relationships with our friends, and relationships with our therapists or our early intervention providers. Cathy, do you know anything about how those can impact families?
I do. This was very interesting to me. So I went digging for some research on these kind of family supports and why it's important for families to have the support of friends or relatives. And there's not, of course, a lot, but the studies that there are show a very strong relationship between the families and what if they have a good relationship with their early intervention professionals. So and is there any definition of what a good relationship is? No. So this is just asking parents, like, do you have a good relationship with your EI professional? And they say yes, and this person's been very helpful, or that it's part of the theme of the answers that yes, they have. So if you have a good relationship with that early intervention professional, you are more likely to have something called a higher family quality of life. And I thought it was really interesting that in this interview, where did the ladies learn about each other? From their early intervention professional. So it might, I mean, it could be anything, right? We don't have enough research to know exactly what's happening. But I think it's important on this podcast for us to say that if you have the opportunity as an early intervention professional or a family services person to connect families that might have similar needs or relationships, that it's obviously you want them to build their own relationship, but connecting them is an important thing that we do.
Yeah, and I would say to families, like, don't ask once and then let it go. Keep asking, because I didn't think this through, like, prior to me working at VIPS. You know, I would ask questions about getting Hannah connected with someone, and if they didn't know anyone, then I'd just go on to, like, the next thing. But that doesn't mean that they're not going to get someone. And with HIPAA and privacy laws and everything, they can't tell you. And there's been so many times where I've been talking with a family on a phone and I know of another one, and I think to myself, man, I wish they would just ask and I could connect them. And so I would say if you ask one day and they don't have anyone, ask again. You don't know who they're going to get tomorrow or in 6 months. I would just keep asking. And, you know, like Hillary said, it does take some time to develop relationships, and they don't all work out because usually we're not connecting based on personality. We're connecting based on circumstance. But I would just keep asking.
Great advice. Yes.
I love that advice. Yes. And from the teacher's standpoint, please ask me multiple times, because I experienced that as well. And just the simple fact of you asking and then reminding me can, you know, really, really be helpful, so that it's just kind of always on my mind as your teacher.
What do we think about how they talked about that text was the most valuable way for them to get together? How do we feel about that?
I love that. That made me so excited, because sometimes the thought of getting together with people or even trying to maintain a relationship, I'm like, oh my gosh, like I can barely do the things that I have to do for our family to make it through this day. But you can see the strong bond they have and how close they are and how they've really helped each other. And that developed over text. So that just personally gave me hope about everything, that, you know, I can maintain friendships over text. I can build friendships over text and, you know, keep in touch with people that way. That made me super happy.
Yeah, I think it's a little different to think. I think some of it, you know, speaking as somebody who's older, you know, text is like, well, that's maybe so superficial. But what's nice about text is that you don't have to answer it right away. So when the phone rings and you have to talk to them, you have to answer it right away. And maybe you're in the middle of doing a tube feed or changing a diaper or going to the park, and you don't have time to do that. But text, when you get home, it's still there. And so you can still answer it. So there are very good things about technology, it's not just a bad thing in our life. So, and I think this is a perfect example, right?
I like how it stays there until I delete it, because sometimes if I'm busy, I answer in my head, but I don't actually send the text. And then I'm later like, oh yeah, I need to actually respond.
I think we all do that. We're all busy. So it's nice to have that. Well, this has been a great interview, Jenny. Thanks for bringing it to us.
I'm so glad they agreed to do it. It was so much fun.
And it sounds like you did a fabulous job, Paige. So.
Thank you. They did a fabulous job being awesome families and awesome advocates. Thank you so much for listening to Feeling This Life. Did you know that this podcast is part of a research study? By filling out the survey in the show notes, you can help our community learn more about how podcasts impact those who care for children who are blind and low vision. If you'd like to support us in making more episodes of Feeling This Life, look for the donation link in the show notes. The show notes include links to resources related to today's episode and ways to get in contact with us. Please join us again next time for another episode of Feeling This Life.